Hi, my name is Jessica Nelson. I'm going to be performing an integumentary exam today. So to begin, Trent, my name is Jessica. I'm going to be performing your integumentary assessment today. So to begin, I'm going to be talking to you and to the camera so that others may learn from this experience.
Okay.
All right, so to begin, we're going to be going over your skin, your scalp, your hair, and your nails. So when doing an integumentary assessment, you're going to first inspect the skin. So as you're looking at the skin, you're noting any odor distinction anywhere. You're also noting the skin color. So Trent is Caucasian, but you're looking at if there's any petechiae, if there's any bruising, and you're looking at the extremities, and you're looking at the back, and you're noting any skin breakdown, and you're noting any lesions that you can see. And I do not see any. So then we're going to move on to palpation. So palpating, we're going to be palpating for those lesions. We're also going to be noting the skin temperature. So Trent's skin temperature on extremities is warm compared to central is also warm. And you're just comparing and making sure that like his lower extremities aren't cooler than his upper extremities. And so his lower and upper extremities are both warm. You're noting the texture and any thickness, and you're noting edema as you're palpating. So on Trent's palms, there are some calluses, and then on like his heels, there's some thickening, but I'm not noting any edema. So then we're gonna move on to the scalp and the hair. So with the scalp and the hair, we're noting the hair color. So with the hair color, dark brown to black, there are some white hairs throughout, but you're noting if there's any color variations throughout, specifically that is like unilateral on one side or the other. You're also noting, you're looking for any lesions. You're looking at if there's any parasites, if there's any, you're noting like the texture, the thickness, and you're also noting like the amount of hair and the distribution throughout. So if there's any balding, like that. So next we're gonna be moving on to palpation. So Trent, tell me if there's any tenderness throughout your scalp.
Okay.
So you're noting if there's any tenderness, if there's any lesions. Trent's hair is straight and it's about a moderate thickness. So you're noting texture, thickness, and you're noting if there's any lesions. You're also palpating and seeing if there's any parasites throughout the hair or the scalp. And I'm not noticing any, which is a good thing. You're also palpating for oiliness. So moving on to the nail beds. So with the nail beds, first we're going to inspect for grooming cleanliness, color, and shape. And I compare bilateral, but also hands to the feet. So noting the color, the shape, and the cleanliness. And then you're going to palpate. So as you're palpating, I'm doing capillary refill, and I'm also noting the texture and the consistency. You want to know if like their nail beds are thicker than any others, especially when comparing like the feet to the hands, which I'm not noting, and capillary refill is 3. All right, and that is it. Thank you guys so much.